As we get older, the risk of having a heart attack increases. This is a very frightening thought for many people, and so that's why I'm here today to give you 5 tips, 5 things that you can do to significantly decrease your risk of having a heart attack. Now, it wouldn't surprise me if there are some people in this audience listening to this who actually already have had a heart attack, because when I give talks, there's usually 1 or 2 people that will come over to me and tell me that earlier at some point in their life they had a heart attack and they've since made some dramatic changes to their lifestyle and they wish they had done this much earlier. So today we are going to talk about some lifestyle changes that you can make. Now, heart disease is very common. Over 1/3 of Americans do have some form of heart disease, and over 1 million heart attacks are suffered each year. However, we also know that up to 80% of heart disease can actually be prevented with a healthy lifestyle, and that's based on data from the American Heart Association and the World Health Organization. I'm Dr. Nancy Feiwel. I'm a physician and I specialize in lifestyle and preventive medicine, which means that I work with my patients on their nutrition, their exercise, their stress management skills, and making sure they have good quality sleep. So let's get started on these 5 important things that you can do to significantly decrease your risk of having a heart attack.
Number 1, decrease your risk for a heart attack by controlling your blood pressure. Hypertension or high blood pressure remains one of the most important preventable contributors to disease and death. Hypertension is also considered the silent killer because many people do not know they have elevated pressure, as they generally do not have symptoms. Blood pressure checks at your doctor, at health fairs, at self-check stations at drugstores like CVS and Walgreens, or with your own monitor at home are so important. Make sure you know your numbers, and if they're over 120/80, speak with a healthcare practitioner to determine the best course of action. Lifestyle modifications are highly effective both for maintaining a healthy blood pressure and for lowering blood pressure. These modifications consist of weight loss to a healthy weight, dietary changes such as those directed by the DASH diet, which we'll discuss in more detail on the next slide, aerobic exercise, effectively managing stress, limiting alcohol intake, and not smoking. The DASH diet stands for Dietary Approaches to Stop Hypertension. It is a healthy whole foods-based diet consisting of fruits, vegetables, whole grains, low-fat dairy, poultry, fish, nuts, and beans. The diet is low in sodium, and the focus is on consuming foods rich in potassium, calcium, magnesium, and fiber. In addition to benefiting the heart, the DASH diet also lowers risk for osteoporosis, cancer, stroke, and diabetes. Number 2, decrease your risk for a heart attack by maintaining healthy cholesterol levels. Cholesterol is actually essential for life. Our cells are made with cholesterol, and cholesterol is the building block for several different hormones. However, you can have too much of a good thing, which can lead to artery clogging plaques when it comes to cholesterol. Elevated cholesterol levels are found in approximately 1/3 of the American population. Your cholesterol profile includes both good and bad cholesterol, which is to say that the HDL, or good cholesterol, removes other forms of cholesterol from places it does not belong, while the LDL cholesterol, or bad cholesterol, can actually clog arteries, and elevated levels of LDL are correlated with increased risk of heart attack. Lifestyle modification recommendations to control cholesterol include a whole foods-based high-fiber diet, exercise, and effective stress management strategies. High stress levels have been shown to increase levels of LDL, or bad cholesterol, in the blood, so it's important to figure out ways to manage your stress. Now, fiber is important for overall health, particularly gastrointestinal health, but it also benefits your cholesterol level by trapping cholesterol in the digestive tract and eliminating it in the stool. At least 25 to 35 grams of fiber are recommended each day. Most Americans do not get nearly that amount. Now, a word of caution. If you don't eat much fiber and plan on increasing your intake, go slowly. Gradually add fiber to your diet over the course of a few weeks to avoid fiber-induced gas and bloating. Number 3, decrease your risk for a heart attack by controlling blood sugar levels. Although there are 2 types of diabetes defined by the underlying mechanism of insulin dysfunction, we are focusing on type 2 diabetes because it is often a lifestyle disease in genetically susceptible individuals. In type 2 diabetes, cells become unresponsive to insulin, which is needed to drive sugar into the cell. The consequence of this insulin unresponsiveness is an elevated blood sugar level, and the consequences of high blood sugar are many, including heart disease, kidney disease, damage to parts of the eye, and nerve damage. The effects of diabetes can be absolutely devastating. The diabetogenic lifestyle is defined as too many calories in, not enough calories used, and obesity. In fact, 90% of people who develop type 2 diabetes are obese. The importance of preventing diabetes and maintaining blood sugar levels within normal range cannot be overstated. Diabetes prevention consists of a healthy diet, exercise, and weight reduction. The diet should contain fiber-rich whole foods, lean sources of protein, and limited added sugar. Exercise should be both aerobic and resistance or weight training based. Aerobic exercise is important for the heart, while resistance training causes blood sugar to enter muscle cells during the workout and also increases the sensitivity of muscle cells to insulin between workouts. Weight reduction has been found to be highly effective in lowering the risk of developing diabetes. In fact, in a multi-year study, researchers found that sustained weight loss of 4 to 5% of body weight for 3 years decreased the risk of developing diabetes by 58% among people who were previously at high risk of developing the condition. Number 4, maintain a healthy weight to reduce risk for heart disease. Body mass index, or BMI, which is a height to weight ratio, is used to categorize people as underweight, healthy weight, overweight, or obese. There are inaccuracies associated with the BMI scale, particularly for muscular men, because the scale does not take lean versus fat weight into account, and that can lead to misclassification of some healthy weight individuals as overweight. Therefore, along with BMI, I sometimes use abdominal circumference to verify if someone is truly in the overweight or obese category. The third way to determine if someone is at a healthy weight is measuring their body fat percentage. Some practitioners and gyms will typically use calipers for the measurement, but that can produce inaccuracies depending on who is using them. A more telling determinant of heart disease risk is the waist to hip ratio. People who have a large waist relative to their hips, the proverbial apple shape, are at increased risk for developing heart disease compared with their pear-shaped cohorts, or those individuals who have a smaller waist relative to their hips. So remember, eating an apple is healthy, but looking like an apple is not. Number 5. To lower your risk of heart disease, do not smoke. Smoking remains the #1 modifiable cause of death. Quitting is not easy, but there are numerous resources available to help anyone who's ready to quit. If this is you, I urge you to visit the American Lung Association at www.lung.org and visit their Quit Smoking page. In the event that you do suffer a heart attack, time is heart muscle, so you want to recognize the symptoms and act quickly. How do you know if it is a heart attack? Some of the signs and symptoms may be as follows: pressure, squeezing, fullness, or pain in your chest. That's one that we're kind of all familiar with. But perhaps you may experience pain or discomfort in one or both of your arms, your back, your neck, jaw, or stomach. You may experience shortness of breath, feeling very sweaty, feeling nauseous, lightheaded, or suddenly feeling very tired. All of these sudden changes can be a sign of a heart attack. It could be something else, but if you're suddenly not feeling well and you think it may be your heart, do not ignore the signs. You need to get help immediately. Tell someone what is happening and ask them to call 911. If you are alone, call 911. Once 911 has been called, take 2 aspirins and chew them. Aspirin inhibits platelets, which are part of the clotting process, and that clotting process you want to stop. So again, chew the aspirin. Don't just swallow them, actually chew them so they get into your system immediately. I recommend that everyone always have an aspirin on them, actually 2 aspirin on them. Keep a bottle at work, keep one at the office, and keep one in your purse or pocket. Also, consider learning CPR. It could save the life of a loved one.
In summary, you can take charge of your health and significantly decrease the risk of having a heart attack. It really comes down to knowing your numbers, knowing your blood pressure, your cholesterol, your blood sugar, and your weight, and of course not smoking. And in doing all these things, you can add years to your life and life to your years. So thank you for joining me. I hope that you found these 5 tips helpful and useful. And if there's anybody that you think can benefit from this information, please share it with them.